Hi guys, it's Sally from the Me Movement, helping you look and feel great in movement, mindset and health. And today I have a special guest here, Kang. He's been here before. We talked about neck pain, and today we are going to talk about the squat. So Kang, a few questions people always come to me when I do a consult with them is, number one, I have back pain when I squat. Number two, Sally, how heavy should I squat? And three, should I go all the way down or should I go halfway? What do you think of those? Is that normal?
No, sure, they're very good questions to ask, and definitely we get asked that question a lot as well. And there's no easy answer to these. It always depends on the individual person. So there is no one size fits all to your squat, and that answer also applies to a whole lot of other movements as well, not just the squat.
Yeah. So if they're having a bit of back pain, could it be that, you know, they've never done the movement before?
Yes, definitely. If you've never squatted before and you're trying to squat without any help or professional help, you can develop back pain. If your form is not very good, if you're lifting too heavy, if your muscles just aren't primed for that movement at that weight.
So let's talk about the body. Now, how come some people can go really low and it's really simple for them, and some people struggle to go past parallel?
The squat is a really good example of a compound or complex functional movement. It isn't just one part of your body that's moving. Your back is moving, your hips, your knees and your ankles.
So everyone's squat is different? Is it something to do with their anatomy?
Yes, definitely. So if your anatomy is different to the person next to you, which it almost definitely is, you're not going to be able to squat exactly the same as them. You might be able to achieve more range or less range depending on how your anatomy is. One of the most important anatomical differences from person to person is actually their hip. So you know your hip is a ball and socket joint. Every person actually is slightly different in their hip joint, and you might not be able to squat the same as the next person. What we're looking at here, I've got a model of your spine. It's got a nice set of legs on them.
Yep.
And right here is what we're looking at, that hip joint.
Okay.
So from the front and from the side, your hip is a ball and socket joint. A lot of people, especially men and women, differ very differently in this angle here. Women tend to have wider hips. Pelvis is a little bit different, which affects the amount of range that you can get in the hip socket. Also in your back, some people might not be able to maintain as much what we call lumbar lordosis here. So if they can't do that, you're not going to be able to achieve that lower squat.
And a lot of the clients that I train, the first thing they do is they're always super conscious about, oh, am I bending my back too much? But the back does bend, right?
Back does bend, definitely.
Yes. It's not always it's not always super neutral. You can't just tuck the pelvis in all the time when you're squatting. You actually have to have that, you know, movement. What about, like, I get clients that come in and say they get comfortable with a certain foot position. Is that related to the hip?
Definitely. So, for the hip?
Yeah.
It probably is more directly related to how your ankle is and how much range of motion you have in your ankle. If the main movement we're looking for in a squat in our ankle is what we call ankle dorsiflexion, and that's when you kind of pull your foot up into this bent position forwards. If your ankle's very tight and you don't have the ability to go into dorsiflexion, you're going to limit a lot of how you're going to squat, and that's going to affect your knees and how your hips are going to move as well.
Because I know I feel more comfortable when my toes are turned out, and I can get deeper in the squat for me.
Yes. So what happens is when you turn your feet out into more of a what they call a sumo squat, you actually can avoid a lot of that dorsiflexion by compensating and turning inwards a little bit.
Okay.
It's for some people it's okay to do, but we're looking at how does that affect your knees position and how does that affect your hip position as well. If it does cause some abnormal movements up there, then I would avoid doing so.
Now I'm going to take you through a couple of variations of a squat. The first one is a bench squat or a box squat, and we use a bench for beginners as a guide so they can know how far to go, making sure we push through the big toe, the little toe and the heel. The second one is a front squat with a barbell or a weight in front. This makes it a bit more challenging and more intermediate. The third is a barbell back squat, and that's the most common squat you see people perform at the gym. You need to have more range in your shoulders to do a barbell back squat.
Now I've got Kang here performing a barbell back squat. And the first thing you should notice is not only are his knees collapsing in, but his pelvis is tilting forward, okay? And it's almost like tucking in. His ankles are tucking in as well. He's just not strong enough to perform the barbell back squat. So what I would do is I would regress to progress, get him doing the bench squats, get him stronger and doing unilateral exercises, and then progress him to that stage. I hope you enjoyed this video of how to squat. My name is Sally from the Me Movement, helping you look and feel great in movement, mindset and health. I'll see you next time. Bye.